we should all have dreams. We should all aim high. I think that's really important. But I think it's also very important that you get the requisite experience to make that happen. Yeah. No, in the beginning, it was self-funded. It was, it was definitely a intellectual gain, but a financial loss for sure. And now we have more investors. People think, and as an advisor, you get shares sometimes in companies, and then I get to see their evolution. And then I had the confidence made to invest more in my own funds. So it started out very organically, and yeah.
And probably also wanted to ask you about the startup funding setup. In India is quite varied because now a lot of funding is towards, what we call as the computer science and IT sector, not so much into the medical device startups as such, because as such, it's a very, very small niche group. But again, because in India, we heavily depend upon, the Western world and the Western companies, and we import about 90% of our implants. That's a
Wow,
fact. So
that's a lot.
so for the billion population. So in fact, but that's a significant factor because it has never been a startup situation or even the industry growth. I mean, it's slowly kind of changing with the policies. But I wanted to know, how is the situation in the US where the startup funding for, especially for the medical, kind of like the sectors, is it like the private funding, or if you were to start, say, say you have a startup and I say I have to go to an investor for,
Sure,
do
sure,
you
sure, sure,
like
sure,
go to
sure.
the government, or do you
Yeah.
just have private funders who will do that?
There are government funding apparatuses like the NIH has. You can apply for grants for this kind of product-based stuff. It is a longer approval cycle. There's a limited amount of funding. The nice thing is they don't take a percentage of the idea, just give it to you. Most startups, however, are usually friends and family angel investing, then a Series A, and then like it's kind of like similar to the tech stuff.
Mhm.
We do struggle with the same things as you do in terms of people want to fund tech
Mm.
startups because, like especially software startups, the multiple on exit is bigger, the overhead is smaller, the sales cycle can be much faster, right? Because you just come up with something, you can release it in the wild very fast.
Mhm.
Versus, especially in the U.S. with all the regulation, from the time you start a startup, you'll be lucky if, you know, 4 or 5 years later you have something in the market because it just takes so long.
Mm.
And so an investor won't see returns for as long, and then the multiple on the sales is not as much.
Mm.
And so definitely the bias is towards, you know, more tech startups, but there is funding there, and most of it, I would say, making just kind of rough numbers, I would say probably 70-80% is private,
Okay.
from private equity people and serial investors and stuff like that. And maybe a small percentage is from the government or from
Angel
universities and stuff
investors.
like that. So it's
Thank
probably the vast majority is private.
I'm
you.
going to go to one of the basic questions again. So, as surgeon, you told we always get problems, and we always try to think about a number of solutions. And you also told you have a black book where you write down the ideas. But in terms of converting them into products, we don't know if this is possible in an engineering world. We don't know if this is possible in a tech world. So, how do you develop it? Do you have a best friend who is an engineer who you frequently talk to, a sibling, or if you don't have most of us don't have an engineering friend in our
Yeah,
circle because
yeah, I
we
wish.
tend to isolate ourselves as we go up in the career. So how do you do? Did you kind of pay an engineer just to talk to him, or
Now, I think I'm still learning this part of it, right? I think I've been around long enough and around enough different companies that I kind of at least can see it through that lens, right? Uh, there's a book called Biodesign by Paul Yock. I think if you're in this industry, you should definitely, look at it. He's a Stanford professor, cardiologist. And it does talk a little bit about how to go from an idea to the market. And in our case, like what the FDA process is, the engineering process, how to look at things. But I think it's a very complicated question, that you asked. But I think some of it is just by thinking about, is there a market for this? Is this truly better than what's out there? Is this something other people can use? How much is it going to cost to develop this? We have actually, my brother does some startup work with other medical device companies. And I think we've been pitched many things in the past, and I think we probably say no 3 or 4 times more than we say yes, just because we're starting to learn these things, right? Sometimes you can have a great idea for a cuff anchor, but if it costs $1,000 to manufacture it, even if it's better than what's out there, no one's going to pay more for something that's incrementally better, right? It has to, especially nowadays, there's a lot of cost pressure. So I think a lot of it's like, product market fit, cost to manufacture, usability in the hands of many people. So there's like a lot of things you look at. So I think I've just gotten better over the years at it, but I'm still learning. This is, I think, a very difficult thing. I think having an idea is one thing, choosing what to develop is another thing, and then the sales and marketing distribution is another thing. So there's a lot of hurdles to go from idea to actual, putting it in
Maybe
people.
we'll talk about a little bit about your time distribution. How much time do you actually dedicate to your entrepreneurship in a week, let's say, apart from your family time? I mean, in terms of actual hours to talk about.
I think it depends on where we are on certain projects. I think probably, standing meetings is at least 2 to 3 hours a week, and then probably just about that much on top of it. So probably, yeah, like 6, 7 hours a week. It also depends if there's, a lot of engineering going on or team meetings, then it might be more, it might be less at other time when things are quieter. So something like that. And I think there's a couple hours a week is just standing meetings.
But you have some dedicated, protected time for those meetings so that it doesn't implicate your clinical work.
I do.
Okay.
I do.
Excellent. And what kind of like advice would you say, somebody who's just coming out of residency and say, okay, I've got this brilliant idea, and they just come to you and say, so I want to become the next billionaire.
Yeah.
I would just, everybody's got these dreams, isn't it?
Yes.
Like, I want to make this Tesla car, and I've just dreamt this car yesterday.
Yes.
But, I dreamt up this next tanker. So what advice would you give to the resident who's saying, I've got this idea, I want to translate it. What would you say to him?
Well, first of all, I would say we should all have dreams. We should all aim high. I think that's really important. But I think it's also very important that you get the requisite experience to make that happen. A lot of us want to take shortcuts or be a YouTuber or social media person, just get paid for being cool or whatever. I think in our field, this, in medicine, there are very few savants. There's not a lot of people that short circuit the line, right? You still have to train, you still have to pass the tests, you still have to prove yourself and then prove yourself and then prove yourself. It's not quite that way in entrepreneurship, but I do think there's a lot of skills. And if you look at when people are successful, there are a few people that, when they're 25 or 30, they come up with their best idea. But I think a lot of people are mentored by other people. They hang out with engineers. My advice to a young person is to actually get in the rooms where these decisions are being made and listen. Maybe if you have time on the side, talk to people and sort of ideate and think about, form your own ideas and make your plan, because it's really, really difficult to just go from 0 to 100, So yeah, that would be my advice.
And it's hard craft. I mean, I want to just probably, ask you, because it's not like, you just dream up an idea and then, in 1 year time, you have a product made. That's probably what the point you're making. I mean, it's hard craft. I mean, even as an entrepreneur, it's a skill that you acquire over a period of time.
Yes.
So,
and our line of business, if you were talking about implants in particular, it's just a slower sales cycle, I mean, or ideation cycle. If you wanted to be fast, maybe you could join a company, or for a young person, maybe there's a way they could be in on a project as just an observer or something that might be interesting. But I think the cycles are long. If you want to do something that makes you rich in a couple of years, probably should go into software or something
I mean,
else.
I think it's not the the next Uber. It is probably to get to a striker, it takes probably 60 years. It's not
Yes.
actually 3 year cycle. Yeah,
Right.
that's
Yeah, and of course you always look at the couple people that were able to do it, and it's great. You should try, but I think having a little slower expectation is more reasonable.
So when you started G Labs, how did you dedicate funding? Is it from your hands, or did you have some investor even at the beginning, even just when you had ideas? Uh, I guess you should.
Yeah, no, in the beginning it was self-funded. It was, you know, it was definitely a intellectual gain, but a financial loss for sure. And now we have more investors and more people, you know, to kind of share that burden. And so it's been good. And I think as your ideas develop and they become more marketable, then you can, you know, kind of de-risk yourself a little bit. But I think in the beginning it was just a passion project, you know, for me.
Excellent. And let's talk about a little bit about your mentorship. I mean, I think you're part of the IACS group. I mean, it's you know, which is a collaborative group between the Indian and the Indian shoulder surgeons as such. I mean, could you actually tell us more about this as such? I mean, Dr. Giri was one of the recipients of this, but that's how we got to know, and you're here, and it's such a honor to have you here in India and then teach so many of your young colleagues. But I want you to actually say how this journey kind of, or what was your part in the IACS, and what do you think and how far this can go?
Yeah, I think, you know, I'm really proud of that group actually. And I think the way it started actually was the way that, you know, a lot of these sort of ideation and projects and innovation go. It was like an innovation in a different way, I guess, you know. Myself and a couple of the other surgeons that you know met at ASCS in New York. And we realized that we're all sort of working in silos and that we all had a desire for a deeper connection with India. We were all a little guilty, right? That like our parents are like you guys, and we're sort of these like, you know, ABCDs on some level or whatever. And that maybe by using our, you know, shoulder knowledge, skills, research and stuff, that we can create that bond that will help us, right? Like being here is incredible, right? Learning from you guys and seeing the work you do has been great. Having people like Yuri come and visit has been awesome. And then you guys maybe will gain something from it too. And so it just started very organically, and we literally met and just sort of divvied up the work. And so like Ranjan Gupta filed the articles in incorporation to become a nonprofit. Sam Nagda was the first president. Um, Krishnan and Paul Sethi did a lot of the fundraising. I was on the membership committee for ASES, so I sort of found like-minded Indian surgeons in the US to sort of be a part of it and emailed them. And so just then we sort of added board members and stuff like that. And so it's one of those things that just started off as a napkin sketch, really, literally a napkin sketch, you know, and then we sort of didn't let each other let it go. And then within 6 months, we had something functional. And then, you know, now that ASCS is recognizing us, in fact, they're at the next meeting, they're going to have us with an hour or two program that we're going to do maybe with Indian surgeons and American surgeons. And they're talking about expanding it to different groups, like having a Latin American one. You know what I mean? So the Indian surgeons were kind of the first to do it, and it was been successful. And so they may even recognize your traveling fellowship, the one that you did, as like an official ASCS ones. There's all these discussions. So yeah, really proud. I feel like it's, I think all of us that are involved are really grateful, and I think it's something that may not only help Indian surgeons, but maybe people from around the world to sort of bond and to work together and to sort of share best ideas. So it's been great.
Yeah, it's been such a good example where, see, you just go back to your roots, but it's almost like searching for your roots, but you just find it in a different way. I mean,
awesome.
it's possibly that. And again, you just recently had a big meeting on shoulder arthroplasty, and we had quite a lot of US surgeons coming, and then we had this, and I'm sure this would lay path for more meetings that happens both in India as well as in the US. I'm sure it'll be a good step. As you said, it's not just for the young surgeons, also for educating and also, knowing the kind of working pattern, how you guys do shoulder, new stuff, or even learning from the India surgeons counterparts,
Totally.
because, their techniques, how are they doing open surgery, how are they managing with limited resources and all that. Yeah. So,
Well, I mean, yeah, at the meeting that you guys invited me to was wonderful. I think you guys have to think a little differently because your resource pool is different than ours. You know, so like it was really cool to see how some people will do like a slide of the rotator cuff in order to pull it over, you know, that's something, or we have more access to graphs that you don't.
Yeah.
So you have to be creative and use the biceps.
Mm.
So all these things actually are really
Or use a peroneus instead of the
right.
Achilles, yeah.
I mean,
So-
it's incredible. So all these things that you guys do out of necessity are very novel in the US because we can just get an Achilles graft. You guys have to figure out another way. So I think we're learning a lot too, you know, and some of these things are definitely going to take hold. I'm 100% going to change what I do based on that meeting a little bit. You know, there's a couple of things I'm taking.
Thank you very much.
Yeah, the IACS has been incredible as far as I am concerned. I was one of their initial fellows and kind of benefited from it greatly. So again, I'm trying to explore the other side of you. You are an angel investor as well. So how do you choose the healthcare startups that you invest? Do you go to the pitch decks and see which startup is innovative, or do you go by the connections? Someone who has closely worked with you is coming up a startup, so I'm going to invest in it. Or are you very judgmental?
Yeah. Well, I think this is like a 1 hour conversation on its own, right? But like, you know, just broadly speaking, right? You have to look at the idea. I think the one thing that you have to look at with investing that we not with products is really the team behind it. Do you believe that these people are honest? Do you believe that they're hardworking? Do you believe that they have the experience to make it happen? You know? So I think those are all things that you would add in addition to the idea, you know?
Promote the integrity.
Right. It actually started out more as I was a serial advisor first, where I was kind of able to go to meetings and see how, you know, people think. And, you know, as an advisor, you get shares sometimes in companies, and then I get to see their evolution. And then I had the confidence maybe to invest more in my own funds, you know. So it started out very organically. And yeah, so it's been a great process. And then through that, you meet their CEO, the CFO, and the team, and then maybe they start doing something else later on. They'll give you a call if it's you know, analogous. Some of the companies I've advised or invested in are through connections that I've made with other companies. So it's been a really cool sort of journey. And I would say most of the stuff I'm involved in is certainly healthcare related because at least it's something I can understand. I don't really understand Bitcoin and all these things very well.
Definitely going to go through the biodesign book. To keep it simple, you are telling we should know the promoter and the stuff we really invest in it.
Yeah, ultimately you're investing in the people, right? Because one of them probably had the idea. One of them's probably going to be running the company. You know, it might be the same person, but and then so it really is you're investing in the potential of those people. And if they've done it before, then that's more telling. You know, so I think that's the number one thing. You know, is the team.
So how do you allocate funding? So in India, some people are going crazy because startups are getting funded irrespective of what they're doing. So people are, very much into investing. They think if they invest some capital today, it's going to grow 10x the next year.
Yeah.
But how do you allocate funding as in a conventional manner? How do you manage the risks?
Oh, well, if it's my personal money, then obviously you should never invest anything that you can't see go to zero, right? You can't invest your kids' college accounts and these kinds of things. And luckily, most of us are in a situation where you might have a little bit. So yeah, I think I don't personally. I mean, look, if it works out, if one out of 5 of them 10x's, then I guess you won. But I don't think I have the expectation that all of them will 10x or even 5x. You know, and some of it is like, oh, you have a friend that's doing something interesting. You want to be along the journey, and so sometimes you might maybe make an investment that doesn't have a clear maybe endpoint. But I think it's all stuff that maybe is a little bit for fun and maybe not as much. It's the frosting on the cake. It's not the actual cake.
Yeah.
For me.
Maybe another, kind of, very personal question, maybe. So, because if you look at the psychology of money, I mean, it's one of the, books. But I think because entrepreneurship is about like making money, adding value. So that's one thing. And, when you're actually doing orthopedic surgery, you're a doctor, kind of adding value, in terms of like, to the patient's comfort, because you're taking away, because there's definitely a part of empathy and because both of them actually are quite divergent in actually even the philosophical way of doing things. So how do you see that? Because there's already a conflict because one is about like giving back, one is about taking it in.
Yes.
It's about like how do you kind of like balance it out? Is it like a good and evil thing, or do you have to just give up, or do you have to like dance with both of them
Well,
at
I
different
think, look, I
times?
mean, this is, as surgeons, you're used to that, right? I
Mm.
mean, we're actually lucky in a way that we get to do something that takes care of your family. You get a lot of positive feedback. You get to work with your hands, I like that part at least. You get to work with your brain. And so we're super lucky. And actually, in entrepreneurship, it's similar, right? Like there is, I mean, financial risk, but there's also possible financial benefit. You're helping people. We talked about, before this about uh, having lower cost implants that are designed for the India market, right? And that's so compelling for me because, in general in the USA, if you need something, you'll get it. Even if you don't have insurance, it'll get taken care of somehow. But in India, there's a very small percentage of people that can afford what they need. It's not what they
Right.
want, it's what they need. So I feel like if it can be very gratifying too. I mean, honestly, some of that stuff I would do for free because if you
Mm.
can expand the market and bring a reverse shoulder to half of the Indian people,
Yeah.
I mean, why are you doing so much good? You're
Mm.
reaching hundreds of millions of people that you can't do that much surgery yourself.
Absolutely.
It's impossible. So I think through your, mentees, through the people you teach, I have residents, you can expand your reach. But I think also this is another way of expanding your reach, is you can just help so many more people than you could personally. So I think you're right. There's a little bit of like a give and a take and maybe some ethical things to sort out. But I think, I think throughout this conversation, like I've been a little bit like, okay, you shouldn't try to get rich quick. You should have, unreasonable expectations. But I think that's also part of it is that I think the main reason to do it for me is intellectual curiosity to see your ideas and
Comes to
change our
life.
field, you know?
Mm.
There's a couple of things I'm involved in that might really change the way we do things. And that's super exciting. And if it benefits my family financially at some point, that's
Yeah.
great. But I think, you know, after doing several thousand shoulder replacements, even more thousand shoulder scopes, you know, it's not that it's routine, but sometimes I'm more used to the variability in that. And I
Mm.
think this is just another way to keep learning and focusing and doing something interesting.
Absolutely.
So I think money would be great. We all want to, I guess live a certain way, but I think the other
But I
stuff
think
to
it
me is more
serves the
compelling.
purpose
Yeah.
because, as long as you make the money, but I think it kind of helps and, makes, because we all need money, I mean, for sure. But I think, with an entrepreneurship, you make a good point that, for example, you can either buy one car for a family, with your own money because you can be a good surgeon, or maybe start a car company, which actually, Tata did, and just bring about like, millions of cars which is affordable. So I think at least the concept wise, I think that's where probably the entrepreneurship and being a surgeon kind of like differs because you're trying to kind of move things away in a bigger direction. And I think if your surgeon brain is kind of applied there, and if you have that business aspect of it, maybe that'll be brilliant. But I think, Giri, I think it's been, a long session. Maybe if you have some final questions.
Yeah, we've been talking so much about entrepreneurship, kind of pushing entrepreneurship into orthopedics through this podcast. But this one last question: what has been your sore point in entrepreneurship so far? What has been the worst?
The worst thing, there's a lot of worse things. I think,
You can list them all.
gosh, no, it's just a very long list. I think uh, there's a lot of lessons to learn as an entrepreneur, and it's really different. As surgeons, you will have a complication, you'll get down on that, but in entrepreneurship, it's like that too. You'll have months where you're just like, oh, things are awesome, things are moving, and then you'll have months where you're like, oh my gosh, nothing's working. We tested something and it failed, and we have to do another round of testing. You know what I mean? So there's a lot of wins and losses along the way. And we were talking about one of them before. Like one of the early lessons I learned was I have a patent on a clavicle nail. And, I did solicit feedback from a lot of my friends. I sent a survey monkey out, said, look, what do you not like about clavicle plates? And then they got all that stuff. And I was starting to nail them. What do you not like about the nails on the market now? There was a Sonoma nail at the time. I got the feedback. So I designed a nail. And then I put it out there again. And it turned out that only like pretty hardcore upper extremity trauma people were comfortable with a nail that went in through the sternoclavicular joint. I had done that design for all the way on my own. So I learned that sometimes when you design by yourself, you can get into a hole, that you need to solicit other people's opinions. You need to keep the end in mind. So there's like so many lessons I learned from that experience, that, and then things have just, that was years ago. So 9 years ago. So I think in the subsequent years, you'll have other experiences where you're like, oh, I just totally misfired on this, and I saw things wrong. So I think it's pretty rare where your trajectory is linear. It's usually like this. So there's going to be a lot of losses. So I guess on the other side is like sometimes you take a loss and you have to decide, like, is this one that I can keep going from? And hopefully it is. But yeah, along the way, it's been a lot of hard lessons for sure. And I think everyone has that. Or your company is 3 months away from not making payroll or something, and then you get another investor, or the right investor, or like you figure something out, or so there's a lot of that, I think, in startup life.
Yeah, ups and downs. But I think it's been wonderful to have you, Dr. Anshu. I mean, not only just as a guest lecturing us in IGOF, but I think spending a lot of time. It's been a busy 4-5 days, but I think given us you've given us more than what we could actually give back. I know it's been a real honor to have you, and I'm sure this partnership will continue, and hopefully we're going to have you more for the meetings, more in India, and also collaborate more with you. Thank you very much.
It's been incredible. And you guys are like so generous with your time, and you've been great hosts. And yeah, this is why we started IASCS, right?
Yeah.
Is to have these relationships that sitting back home on our own, it's just much harder to do, but working together, we sort
Absolutely.
of built the bridges, and we're going to continue to keep building them,
We should definitely thank IACS. It's the one I got introduced to you and to the US. Yeah, definitely. And you have been very generous to us. Telling equally about your wins and losses, sharing the tips and tricks along the way of entrepreneurship. I guess this podcast will inspire some of the orthopedic surgeons into out of the box thinking, make them stay curious, at the same time stay cautious, knock the right doors, allocate good amount of funding. These are some of the great messages that you conveyed us, and I guess this is going to inspire a lot of us.
I mean, ultimately, look, the shoulder in the last 40 years has 100% changed what we do. In the next 40 years, it's probably going to change that much, and someone has to figure it out, right? So someone who's watching this, maybe us, if we're lucky, we'll make those incremental steps, right? So I think there's a lot. Sky's the limit. That things are going to change so much, and so hopefully, surgeons should be leading it.
Thank you very much. Thank you very much.
Thank you very much.
Thank you.
Thanks.
Thank you.
Okay.